everyone. Good afternoon. This is Tracy here at American College of Healthcare Sciences, and it's my pleasure to welcome you to today's webinar on the Natural Standards Database. We're excited to be here today with Charles Parsow, who is our Natural Standards Database trainer today, and we're going to be learning about the many tools this wonderful subscription database has to offer. So just a few housekeeping items before we get started. You may have noticed that your line has been muted, and that's just to protect the quality of our recording today, because we will be sharing our recording with students who could not be here today. We will be having a question and answer session at the end of the call, so as you have questions, enter them in the left-hand chat box on the toolbar you should see just on the left-hand side of your screen. And if you have any trouble or questions throughout the session, just feel free to type them there, and we'll respond as quickly as we can. Now, what I'd like to do before I turn the call over to Charles is I want to take just a moment to show you how to access the database for those of you that may not have discovered the database yet. The database is provided to you as a subscription that we make available to all students through the virtual library. So to access the virtual library, you will log into your online classroom. And on the bottom left-hand side of your menu, you're going to see the tab for Library. So we're going to click on the Library tab. And here we're going to see some general information about how to use the library and the databases. Note that there is a login and password for the databases. When you look at the password, the end of the password is 00. And I'll just highlight that here. So throughout the library, if you're prompted to enter a password, this is where you'll find the information. And I do just also want to take a moment to make sure that everybody can hear me. So if you're having any trouble hearing me, just enter a quick note in the chat box. And if you can hear me, someone give me a quick shout out via the chat box as well. Just want to be sure that everything's coming through for you. So once you have referenced the login and password, you're going to actually click on the databases page. Here's where you're going to be prompted to enter your password. Oops, let's try again. And it is case sensitive. Okay, one more time. Okay, so here we're now seeing the subscription database page. So this is how we're going to actually enter the database. Okay, so we're going to click on Natural Standard to access the Natural Standard database. And this is where Charles is going to walk us through using the different features of the actual database. There are some great features like interaction checkers, complete monograph, and herbal and essential oil monograph details, supplement information, so really wonderful tools for all of us. So we're going to hold just a moment while I transfer the presenting over to Charles. We're taking just a moment here to transfer over the presenting, so just a moment. Great, Charles is almost with us. It'll be just one moment. And Charles, if you could just give a brief introduction so we're sure that the sound is coming through from you, please.
Pardon me?
Hi, Charles. Sorry about that. Would you mind starting again? I've just updated the sound.
Sure. Hi, this is Charles Parso calling from Natural Standard. I'm a new director here in the Member Services team and very happy to continue working with the ACHS. And now I'm unmuted. Okay. Can everyone hear me?
Sorry about that, Charles. Slight technical difficulty. Now we're set.
No problem. Also, please let me know when you'd like me to do another introduction. I'm happy to do that.
Yes, Charles, if you wouldn't mind doing just one more quick introduction, that'd be great.
Sure. Hi, this is Charles Parso calling from Natural Standard. Very excited to be working with you all today. I'm a new director here on the Member Services team, and I'll be working with the ACHS and very excited to do this demonstration of the Natural Standard database for you all. Do we have all registrants in attendance today?
It looks like we do have a great crowd, so I'm so excited that so many students could join us today.
This is great. Thank you so much, Tracy, for setting this up. I'm very excited to do this. And please do let me know when you'd like me to proceed and once all the audio's settings are all good to go.
We are good to go, and you're set to start. Thanks so much.
Wonderful. All right. Thank you, Tracy. Again, my name is Charles Parso, a director here on the Member Services team. My direct line is 617-591-3344. I'll repeat that at the end of the presentation, but just in case you all need to reach me, please feel free to reach out. I'm happy to provide any support to you all that you may need. But let's go ahead and jump into the presentation. I'm sorry, I'm a little bit late, but I do appreciate you all taking the time to meet with me today. I'm going to be going over the Natural Standard database and introducing you to the Natural Standard Research Collaboration. And if you're already familiar with the resource, I'm certain you'll learn something new today. We do update our training all the time. We're updating the website all the time. And if you're not familiar with the database, then this is going to benefit you quite a bit, and I'm very excited about that. So let's begin. The Natural Standard Research Collaboration is headquartered here in Boston, Massachusetts. Our mission is to generate evidence-based, consensus-based, peer-reviewed information on the safety and efficacy of CAM, which, for those who don't know, is complementary and alternative medicine. Clinicians rely on Natural Standard database to reference clinically relevant information on supplements. So this could be coenzyme Q10, glucosamine, the popular things you hear in the news. Also different alternative treatment modalities such as chiropractic, acupuncture, as well as diets. Natural Standard, we initially started as a journal club, so a group of academic clinicians from Partners Healthcare, Harvard Medical School, and the University of California who recognized a need for reliable information on CAM for both safety and provider liability reasons. Before Natural Standard, there was inadequate centralized monitoring of quality, safety, and effectiveness of these treatments despite their known side effects, interactions, and the risks associated with them. So our founders recognized a trend in healthcare toward patient-centered or patient-driven care. And today, patient-centered care is founded on the principles of information sharing, transparency, patient participation, and provider-patient collaboration. Research does show that patient-centered care improves treatment regimen adherence, patient satisfaction, and overall patients' health outcomes. When it comes to alternative medicine, there has traditionally been a communication gap or barrier between provider and patient. Providers traditionally are not educated on these therapies, and they just don't have the reliable source of information on these products, yet patients do have an intense interest in them. we see over 70% of patients taking natural products, and over 80% of cancer patients do take supplements. Lastly, over 350 million U.S. adults visit alternative medicine providers. There are risks associated with not discussing alternative medicine, and patients can lose trust or might withhold information from their provider, or they may seek treatment elsewhere if they're not able to get the information on the supplements that we know that they're taking. As we go through the database, you'll see how we research all the studies and consolidate all the safety and efficacy information available on these products. You'll see how we meet such high standards of quality, reliability, being unbiased, peer-reviewed, and evidence-based. We'll discuss clinical decision support and how we offer shared decision-making through the use of comparative efficacy charts. Each therapy is graded with a report card, and that's based on the U.S. Preventative Services Task Force. We will demonstrate how we physically critique each study to allow clinicians to make quick, informed decisions at the point of care. And each systematic review in the database undergoes blinded, multidisciplinary peer review, and all of the clinical trials are analyzed, critiqued, and supported by statistics. So with that, let's just go to our introduction, our homepage, and jump right in. So the website URL and homepage is located at www.naturalstandard.com, and Tracy and I discussed this earlier. You do all have unlimited access to the database, so within your healthcare, within ACHS, you do have access to Natural Standard database. So this is the web page, as you all can see. Let's go to the About Us and click on Editorial Board. Here you'll see the list of over 500 multidisciplinary contributors, authors, editors, translators, and statisticians. All authors and editors are required to either be seeing patients or be actively researching in this area. Let's go back up and check out the research methodology. You'll see that the databases and journals that are searched, the inclusion criteria, data analysis, review process, and update process. All of our contributing authors are editors, and they're healthcare professionals and are required to be actively seeing patients or actively researching in this area. All of the content on Natural Standard undergoes multiple rounds of blinded multidisciplinary peer review prior to inclusion in the database. And it's important to note that Natural Standard is not just for pharmacists. It's for people who actively see patients. So this could be pharmacists, nurses, oncologists, physicians, dietitians, and nutritionists. It's just a side note, Natural Standard database is updated in real time, like I said, so it's great that we have people on board to see what the new features are, as well as those who are unfamiliar with them completely. And we do monograph overhauls biannually. I'll get into what a monograph is in a little bit. But to start out with, you do see at the very top right of the web page is a search bar, and we recently added this feature, and it's a proprietary search algorithm that promotes all relevant information within the database to the top of the Google search results. So when a user searches for food, supplements, modalities, diets, medical conditions, etc., the database promotes our monographs to the top of the search results. It also provides quick links to the most search sections of each monograph. So this could be an interaction, allergy, mechanism of action, etc., and we'll get into this in a little bit. But the database also allows for combination searches, so you can search for multiple supplements and medical conditions all at once. Alternatively, you could go back to the home page and use the pull-down menu to search the databases. Let's go ahead and jump right into the meat of the website and the database. If you click the database drop-down toolbar, you'll see we do have the foods, herbs, and supplements database, and you have the option to select from over 1,500 natural products, supplements, functional foods, and vitamins and minerals. Competitors only have a small subset of these supplements in their database. We try and be as thorough as possible and cover the whole spectrum of what people are using. You can search these alphabetically or narrow your search at the top by clicking on a subcategory. For demonstration purposes, let's select a supplement, say St. John's wort. So I'll go to the top here and click S. Scroll down and find St. John's wort. This is a very popular supplement, so it's a nice little run-through and real-world example. You will now be prompted to log in, as you can see. For me, I have my login credentials already in there. For you all, because you're authenticated, you will actually not see this screen. So it's luckily you get in, and at the top you'll see that it does say logged in, and it should say log out to the right. If it doesn't, then there is a problem, and please give me a call and we'll get that squared away with the IT team and do whatever we can to get you all access. But it should be working perfectly. No real problems there. So here we are at the St. John's Wort monograph. At the top of every monograph in the database, you can select a reading level. We have the professional reading level, which is for clinicians. Bottom line, which is for consumers, researchers. Flashcards, which just a very quick snapshot overview of potential safety concerns. You can also check out references and news topics. So maybe this might be product pulled from shelves, dangerous contaminants, etc. And you can also print and email handouts in multiple languages right on this screen. You can also take 100 ACPE accredited CEs and AMA Category 1 CMEs right in workflow and submit reports right here. Each systematic review in the database has navigation links on the left side, as you can see here. Before looking at potential interactions, adverse events, and precautions and contraindications, it's important that we demonstrate the evidence table, evidence summary, and evidence grades. These three sections of the database demonstrate our credibility and our scientific rigor. So if we click on the evidence table, we see here that this is a list of all the studies on these products, including foreign studies. First, we can show you the evidence and where we critique all the studies on this supplement. So the first column here lists the condition that the supplement or modality was intended to treat. So St. John's Wort, as you can see, is indicated for depression, mild to moderate in some cases. As you move left to right in the table, the assessment criteria becomes more and more stringent. Columns include how many subjects were in the study, were the results statistically significant, what was the magnitude of benefit, what was the quality of the study, and what was the number needed to treat. If you click on one of the blue links at the top of the evidence table, a new page will pop up, and that will give you an explanation of each of the columns. So I just clicked on the evidence table column explanation, and this will give you an idea of what the different columns mean. So if I were to click on quality of study, we'll see that here we go to the JAWS score, which is used over and over again to describe the legitimacy of a certain study. So was it randomized? Was it double-blind? Was it placebo-controlled? Very important criteria for doing a statistically significant and scientifically significant study. So let's go ahead and jump over to the evidence table. So back here, evidence table, as I said before, this is where you'll see all the different studies that were listed for this particular supplement for St. John's Wort. We can go down to evidence discussion, and you will now see that our authors and editors have summarized each trial that's listed above in the evidence table. So this can allow clinicians to easily refer to the study if they want to dig deeper or if the patient wants information about a study. All blue links in this monograph are clickable, and they'll be linked to either PubMed abstracts or helpful tools, so drug lists and examples. Black links mean that the study has not been published yet, and this entire database is compatible with Link Resolver and federated search databases. So let's go to evidence grades up here, jumping up. If you click on the evidence grades, you'll see that we do summarize the effectiveness of treatments using an ADAF report card. A grade of an A means that there is strong scientific evidence supporting the supplement's ability to treat the particular condition. A grade B means that there is good scientific evidence. C means there is unclear evidence and the research is inconclusive. And D or F means it could actually make the condition worse or have the opposite effect. If you click on this evidence grade button right here, you'll see a greater explanation of the grades that I just described to you. It's strict and helps to promote consistent advice across departments and healthcare disciplines. So let's jump back. Now we will go to evidence grades and click on an indication. So I'll go ahead and click on anxiety disorder, and here you'll see that this is a comparative effectiveness chart. So essentially this is a listing of all the different supplements, modalities, therapies that are used to treat this given condition. It's an important component of a patient-centered care model, and hospitals are currently adopting this, and they have adopted it otherwise. We have additional navigation tabs within here. So let's go back here and click on the synonyms. Here you'll see a list of synonyms and combination products. These are searchable in the search box at the top right, like I mentioned before early in the presentation, and it's similar to an IdentiDex IdentiDrug program. We can click on the bottom line, clinical effectiveness, and here you'll see a general summary of the supplement's safety and efficacy. Below the evidence grades are historical, common, or theoretical indications which lack sufficient evidence. These are all the conditions that the supplement has been purported to effectively treat, but we just don't have the scientific evidence to support the claims, and it's just not out there at this time. If we click on dosing and toxicology, you'll see this is the adult and pediatric dosing concern, standardization, and dosing used in clinical trials. Let's go ahead and click on precautions and contraindications. Here you'll see all the allergy and adverse event data that we do have. This is sorted by system, bodily system. If we click on interactions, this includes interactions with drugs, foods, other supplements, herbs, labs. If you click on one of the drug classes on the left, right here, it will link to a page that lists all the drugs you should be concerned about. These are the common drugs as well as the pharmaceutical brand names. Let's go to mechanism of action. This is the effect on the system, so what sort of enzyme or receptor does the supplement or drug bind to? Pretty extensive for St. John's wort, as you can see. History, this is a historical information about the product or supplement or therapy. Products studied, this can be used for formulary decisions, shows all the brands used in statistically significant clinical trials, and this also lists products that can be tested by third-party testing organizations such as consumer labs, USP, Consumer Reports, among many others. Here we'll go to author information, and these are the multidisciplinary contributors who have contributed to the monograph. Lastly, we'll check out the references and see that these are the over 300 references from the many monographs and studies that we have taken information from. Next, we'll check out the health and wellness database. Go up to the database toolbar again, like I just did, and click on health and wellness. This is a table of contents of over 700 complementary therapies. This includes modalities like chiropractic and acupuncture, as well as diets, so the zone diet, Atkins diet, fitness and exercise topics. Let's go ahead and click on acupuncture, a very popular topic. And this opens a 70-page systematic review on acupuncture with the same navigation and features as the food, herbs, and supplements that I just showed you all. It includes an evidence table and discussion, grades, interactions, precautions, contraindications, etc. As I mentioned, it is 70 pages, so I would not advise printing it out. It's pretty lengthy, and you'll go through paper quickly. Let's go back up to the database toolbar dropdown, click on Comparative Effectiveness. Here we have over 2,800 conditions listed in this database, and each condition links a comparative efficacy chart, which is what I showed you earlier with St. John's wort, and that would just be the different supplements that are used to treat this certain condition, or modalities, or therapies, or herbs, or drugs. Professionals can compare and contrast the effectiveness of natural products and alternative treatments right here for these different indications. If we go to charts and tables next, you'll see categorizations and classifications of all the herbs and supplements. So you could reference all of the natural medications that raise blood sugar levels, let's say, or those that might affect heart rate. This is a clinical tool that can be used for drug reconciliation processes within a hospital. Next, we'll check out brands, manufacturers. This is over 45,000 multi-ingredient products sold by retailers. This runs from Walgreens, CVS, GNC, etc. And you can search by product name or by manufacturer. You can select a product, select the ingredient, and then access the corresponding herb supplement monograph and related information within that specific part of the database. So for instance, go to magnesium, and here is our monograph on magnesium. And it's all the same information, all the same toolbars that I described to you earlier with St. John's wort. Next we'll go to medical conditions. This includes over 3,000 searchable medical conditions and offering a comprehensive overview of each medical condition along with traditional and alternative treatment options. So patients, providers, they can gain access to all the available therapeutic treatment options. This is often used to build personalized prevention plans as well as for annual visits and follow-up visits. Next, we'll go to the sports medicine database. This includes sports medicine topics taken from the Herbs and Supplements database, the Health and Wellness database, and the Medical Conditions database. It covers sports-related supplements, modalities, and conditions. So this could be natural products for weight loss, performance enhancement for athletics, chiropractic for sports injuries, etc. Very extensive database as well. Next, we'll check out the genomics and proteomics. This is, like the title says, a database on genomics and proteomics, all the different topics related to it. We also have an environmental health and global health database for all topics related to that, as well as an animal health database for the lovable pets. Next, we'll go to a very advanced and useful feature on the Natural Standard database, the Interaction Checker. And here we clicked on the Interaction Checker Advanced, and this allows users to search for interactions with supplements and brand name products, other supplements, generic drugs, and brand name drugs. So you simply type in the name of a drug, supplement, or brand name, and then click the Add field. So let's go ahead and click, let's do St. John's wort. St. John's wort. And as you'll see, these are different colors, and it's important to know which color it is because that will correspond to either a herb or supplement or a brand name product, generic drug, or brand name drug. So let's go ahead and just click on St. John's wort, the herb, so that's going to be the dark green. Go ahead and click on that. And I can next type in another substance such as yasmin. Let's say someone's using that for birth control. This is the brand name drug. As well as melatonin because I need it for sleeping, and someone told them that it helps a lot. That was melatonin. There's that. Again, the dark green indicating it's an urban supplement. So here we see there are many interactions found between all of these supplements, and you can click on these and they'll give you information about the interactions. So if we click melatonin and St. John's wort interactions, right here we'll see all the different studies that have shown these interactions. This is printable and very helpful to discuss, with the patient or with yourself or whoever, the dangers of risks associated with taking two different supplements. We have also a basic interaction checker, which obviously is not as advanced. It's a simplified version, and it allows you to quickly scan all natural products in the database and check for potential interactions. A much quicker way and not as thorough. We can go to drug depletions next, and this is a database that allows you to select a prescription drug and see which vitamins, supplements, or minerals are depleted by that drug. So this is very useful for physicians, retail pharmacists, a useful tool in general. We can click on Depletions, Herbs, and Supplements, which is very similar. This is just showing depletions caused by herbs and supplements. Also vitamins, amino acids, lipids, etc. Next, we'll check on the Symptom Checker. This can show you the different symptoms that are associated with a particular condition. And Adverse Effects Checker. So this here we're going to check to see which supplements may be causing specific adverse effects. We're always updating this. There's always information coming out from consumers who report it, from clinicians who report it. Apologize for my internet being slow. Okay, it's back online. And next we're going to check out the tools. So you go to the tool drop-down and click on Therapy Finder. This identifies the appropriate therapies for medical condition, medical history, diet, health interests, etc. We have a calculator function. We have 28 professional calculators within here and 16 consumer calculators. We have a dictionary which contains CAM and allopathic medical terms, about 70,000 of them. We have patient handouts, which are good for giving to patients who want information about certain supplements, anything related to the alternative medicine and that sort of care. We have a recipe database, which is right now is about 1,000 healthy recipes and growing. And we actually added a new feature to it, which is very nice. You can search based on number of servings or by a special diet. So a diabetes meal plan, high protein, high fiber, low salt, Mediterranean, vegan, vegetarian, good for catering to people's individual health needs. And I actually helped to add some recipes here, and there's some good ones in there. It's not just a bunch of junky old healthy recipes. There's some real tasty ones in there, so I use it sometimes for my own cooking. Next we'll go to practitioner search, and here you can locate CAM practitioners in city, state, and find what people are actually using these therapies and can help. Training programs to get trained on these certain therapies. Next, we go to another very important part of the database, and here you'll see the continuing education. The American Pharmacists Association has included and identified dietary supplements and alternative medicine as one of the most sought-after educational topics due to the lack of formal training on natural products. And here we have over 100 ACPE accredited CEs and AMA Category 1 CMEs. And Natural Standard is recommended by the American Academy of Family Physicians for evidence-based CME designation. And our members can take these CMEs right in workflow, right as you're setting a database or a supplement or an herb, or whatever the case may be. And I'll lastly go over these very quickly. We have news and events, so you'll see what products are pulled from shelves, what contaminants might be found in certain supplements, are there any warnings out there for different herbs or products. Here we have CAM events, so these are events related to different therapies, different supplements across the whole world. A free monthly newsletter that you can sign up for. Here's the RSS feed to get these news and events to your desktop. And webinars, these are very important. These are for training. I'm very happy you guys are with me today doing this, and if you feel that you would like some more training, there's certainly more ones offered in the future. And I'm happy to go over some more features in detail with you later on if you feel that there are certain features you like more than others or use more than others. Audio and podcasts here, just like it says, we have podcasts that we offer. There's a health and wellness blog that we are constantly updating and adding to. And lastly, social media. We are on Facebook, Twitter, you name it. So please follow us, and we're happy to work with you and through that. That concludes my presentation. I'm very happy to have done this with you all, and excited to work with you. Please don't hesitate to reach out to me. I will give you my phone number now if you need to reach me directly. My number is 617-591-3344. And my email address here is cparsow, C as in Charles, P as in Paul, ARSOW @naturalstandard.com. And happy to answer any questions you may have. I do see Diana Hodges asking about subscribing to the podcast via iTunes. If we go here, you'll see that we do have an iTunes page, and you can click on that right there and follow it to the subscription to the podcast.
Charles, I think there was a question a little bit earlier about the CMEs.
Oh, sorry about that. I didn't see that.
No problem. Just scroll up a little bit. There's a couple questions embedded in there.
Let's see here. No, the CMEs are provided at no cost.
Perfect.
Yes, very good question. Does the database provide information on extraction processes for herbs and their subsequent lab testing procedures to ensure activity levels? No, we do not have any sort of information about that that I know of. I will certainly get back to you on that. I know that we do have standardization information, so the different active chemicals within there and their concentrations, but nothing about the procedures related to that. There may be some information within the monograph that we reference, but we don't cover that particularly. But again, I'll follow up with you on that and get that information to you. I don't believe we do have that. Can we DL this info? Oh, download. Looks like someone answered. Yes, by going to print icon. Yes. Yes. Oh, glad to see Diana. You enjoy it. we're glad to offer it, and glad you guys can find some use out of it. we're constantly updating it, and it's been hugely helpful for many organizations, healthcare systems, and just constantly getting better. So, and you all do have free access too. So please, check it out as much as you like, and go through that. I know I talked to Tracy yesterday about a question a student had a while back about referencing the information within monographs, and I actually do have that for you all, and I can go ahead and provide that document to Tracy, who could kindly forward that on to you all. If that's not the appropriate method, I'm happy to provide it otherwise, but I do have that for you all, and it's straightforward, and we're happy to let you all do that.
That would be perfect, Charles. We'd be happy to forward that to all participants so that they have that for their reference moving forward. That's great.
Sure.
Okay, we have a couple more questions.
Yeah, okay, Jean. How much does it cost? I'm actually not sure. That'd be a question for the sales team, and you'd have to kind of inquire, and they'd be happy to work with you if you mention you're from ACHS and have worked with the database before and love it. That's something that we'd be happy to work with you on. Let's see, James. Going down the podcast right from the site. We are able to. I believe this XHML feed would allow you to do that, but I'm not 100% positive on that. I can get back to you on that as well. We do have a bunch of saved podcast information below archive webinars. So we have the audio as well as the PDF versions of these different presentations.
Those were PDF transcripts of the podcast?
Transcripts of the podcast.
I'm sorry, I was just looking where you were, where there was the PDF hyperlink. Was that a transcript?
Oh, down here? Yeah, I'll scroll down. Sorry.
Thank you.
Yeah, so here these are archived webinars. So what I'm doing now is considered a webinar, but we also have our students on rotations who do prepare these webinars for different conditions and supplements. So here you're able to access, let's say, the presentation, the PowerPoint presentation about congestive heart failure, as well as the audio for that. The PDF is not going to be a transcription. It's going to actually be the PowerPoint presentation, and that will cover the clinical indications, safety, efficacy, different treatments that they do offer, as well as different patient cases that are something that a pharmacist would see commonly in practice, and then also the supplements that they would suggest to him, as well as the interactions that those supplements may have with his current medications. So, that's what those would be, these integrative approaches. Those are PowerPoint presentations. The other ones are just, question and answers with certain professionals in the field who have some knowledge about a particular topic related to alternative medicine.
Okay, perfect. So those are great reference tools to find more information.
Yes. Let's see. If you were to put a topic into the search area, would the archive webinars show up as well? I believe so. Yeah, let's go ahead and click, type in, yes, so let's type in Parkinson's disease. So unfortunately, it looks like it should be logged in here somewhere, because I know it is usually added to our newsletters as these come up. You might have to scroll through these different pages to find that, as it's not right here, and you don't have an easy way at the top to go through it. But it should be archived on the site, yes. And if I right-click on the link and I don't believe you're able to download the podcast from the website. That's something you'd have to watch on the site. These are additional ones right here as well. So this would be the audio of some of the ones that I mentioned before, as well as some of like the newer events and newer highlights in alternative medicine research. Any other questions? Again, my number here is 617-591-3344, and I'll go ahead and type in my email address to the whole audience. That way you all have it. I'll type in my phone number as well in case you didn't catch that the first time. And please do reach out if you have any questions or need any support in any way. We're always happy to help and love working with the students and the people who actually are using this at the point of care and finding such great value in it. So let's see, there's that. And again, I'll give Tracy the document explaining how to cite our monographs. And of course, we don't advise any sort of therapy or supplement or treatment above any others. We have the evidence. That's it. There's no suggestive component to it. It's just purely the objective, the science. Here's what we've compiled, and here's what's out there.
Thank you so much, Charles, for all of this great information. And I can see from the messages in the chat box that it's been really useful for our students. So I'm really grateful. And for all the students listening, if you have any follow-up questions for how to access the database through your online course, you are, of course, always welcome to contact your instructor directly or to just give us a call here at the college at 800-487-8839, and we will be more than happy to assist you. So if there aren't any more questions at this time, I think we'll go ahead and end the call. And thank you again, Charles.
Oh, my pleasure. Thank you guys very much. You've been great, and those were awesome questions. I appreciate working with you all. Reach out to me at any time if you have any questions or need some support.
Will do. Thank you so much. Have a great day.
All right, you too. Take care. Thanks.